Hello, welcome to KHL Health and Life. I'm your host, Kristen Wolosinovich, here for the first time in the KHL Health and Life Detroit studios. My partner in crime, Lisa Metropolis.
It's great to be here. I'm really excited. Very excited today.
Aren't these great?
Yes.
So our inaugural KHL Health and Life Detroit studio, we are so excited to have two amazing guests. I'll start with my left, the beautiful Susan Douglas. Hello.
Hey, Kristen, how are you?
Thank you so much for
Thank
being
you for
here.
Thank you.
And your miracle man, right, that you brought on, and a big thank you to you. Dr. Concret Shayasset, you are a plastic reconstructive specialist out of Royal Oak, Beaumont, correct?
Right.
But it's not just plastic surgery, correct, doctor? What are some other specialties that you're familiar with that you correct?
So I am specialized in microvascular surgery, in which we transplant tissue from one location to another,
Okay.
and also specialize in pediatric plastic surgery, from cleft lip, cleft palate to scalp surgery to a pediatric soft tissue reconstruction.
So pediatrics is also one of your specialties. Have you always wanted to go into this when you were going through med school and you were defining your specialty? Was it always in plastics?
No, not exactly. I was interested in a transplant surgery
Really?
or hepatobiliary surgery, and my mentor, Dr. Ian Jackson, really motivated me and inspired me to become a plastic surgeon. Just like all of you, when you think about plastic surgery, you would think about breast augmentation.
That's what all
liposuction.
augmentation, yes.
And believe it or not, that's how I was felt at one point. Then there's the other side of plastic surgery, that you can do a lot of good thing and change people's life and restore and make them feel whole again.
What is your native country?
From Thailand.
From Thailand. How long have you been here in the States?
I came 2001.
2001, so roughly 18 years. Did you come to med school here in the
No.
United States?
No, I finished medical school in Thailand.
Okay.
So during residency training program, it's a system called matching system. So I happened to match here in Michigan by chance. And so that's why I'm here.
So you've been in Michigan for 18 years. It's your home now.
Yes.
Well, Susan, we are very lucky to have the good doctor, aren't we?
I am so thrilled that he ended up matching in the state of Michigan and that our paths crossed,
Yes.
for sure.
That's exactly right. So, Susan, real quickly, tell us a little bit about your journey.
Sure, I'd be happy to. So I was diagnosed with breast cancer in 2013. At the time, I was told I was going to need a mastectomy, and the breast surgeon that I was seeing that was going to do that surgery, she sent me to a plastic surgeon, but not someone who specializes in all the different types of reconstruction. So at the time, I was pretty much given the option of having breast implants put in to make myself whole again. But what I didn't know at the time was that implants come with their own risk. And even though, mainstream news and what the manufacturers are telling you is that these implants are safe, they are not safe. And for women whose bodies totally reject those implants, it can lead to serious, serious health issues, everything from cardiovascular issues to digestive issues to autoimmune disorders, body inflammation throughout your body, waking up. For me, it was I was constantly exhausted. I was in pain every morning. I looked like a 90-year-old woman getting out of bed. I had 3 cardiac surgeries in 2016 because of heart issues that nobody could explain and nobody could correct.
Wow.
So in that journey, I started to research what could possibly be causing the problems, right? A woman in my late 40s, I had multiple doctors tell me it was perimenopause and that this is how women are supposed to feel, and I refused to believe that. I refused to believe that that's how I was going to feel the rest of my life.
Right.
So by God's divine grace, I happened to be scrolling on the internet one day and found this page that was talking about breast implant illness. And I started to understand that there could be significant problems and significant issues, and that hundreds of thousands of women have had these issues, and the only cure for it was to get the implants removed. That was how the journey then led me to find Dr. C. I contacted my surgeon back to find out if there was anybody that in the area that specialized in doing a DIEP flap procedure, which would use my own tissue to recreate my missing breast.
Is that a high-risk procedure that only a few can do?
It's not necessarily high risk. I think it's time consuming.
Okay.
It's very meticulous, and you need to have a stamina and spatial train. So again, we transplant tissue from the stomach and then reconnect the blood supply in the chest. And so many things could go wrong. So you need an experienced surgeon and spatial train to perform such procedure.
How long have you been doing the surgery?
Since 2011.
Oh, wow. Okay. So that's quite some time.
A long time. Yeah.
And is inflammation one of the first signs that there is something wrong? Is there something for women who believe, such as Susan? Susan's an outlier. She's an advocate for her own health. She's intelligent. She knows when something's wrong in her body. But as women, we don't often take care of ourselves. What are some signs to look for?
So it's the breast implant illness is relatively new, and I think that WHO and even FDA itself still hesitate to accept the diagnosis, even though the last panel, I think in March, they came out with a very pretty comprehensive list. So the most common symptom is fatigue.
Fatigue.
And then a brain fog by definition.
Flu-like symptoms
Right.
would
and,
be. Yeah.
Some joint pain, sleeplessness, and those are systemic symptoms that I could see that some doctor thinks are
Perimenopause.
Right.
Yes. They match up.
Right. And initially, to be honest, before I met Susan, we heard about that. We're like, oh, no, not really, because it doesn't show in our textbooks.
Right.
And then even on the implant company, they didn't mention that. So as a young doctor came out from the training, if the implant safe, it's probably safe because FDA says so.
Right.
So, and then as we see a lot of more patients, I learned from Susan and myself the way she responds after surgery, the clinical manifestation immediately after implant removal. You can see a drastic change in many things.
Almost immediately.
It was almost immediately. Within 48 to 72 hours after surgery, I physically started to look different. My husband looked at me and said, I forgot that your eyes looked like that. The whites of my eyes had turned yellow. My eyes were so dry all the time I couldn't wear my contacts anymore. It was manifesting itself throughout my body where, if it's just one symptom or two symptoms, you maybe don't notice it. But at the height of all of this, I was on 9 different medications at one time. I was constantly taking pills. I now take absolutely nothing for my heart.
That's incredible.
It's incredible. I was taking digestive medications because I was having horrific acid reflux. I can eat anything I want now, and I don't have to take anything.
It was life-changing.
It's completely, I feel like it was like the fountain of youth. It's like he turned back the hands of time, and I got back that 5 years of my life. I feel fantastic.
Susan, I saw pictures before and after pictures, 2 weeks prior and 2 weeks after. And I honestly was absolutely amazed. You did not look like the same person.
No,
it changed your face.
It did, because there was so much inflammation that was throughout my body. My nose was larger. My eyes were puffier. Within 2 weeks of surgery, I lost 15 pounds.
Yeah.
I didn't do anything to lose 15 pounds other than the implants, and we know they weren't 15 pounds. But it was, I could fit in my clothes again. I could wear the rings on my fingers again. The joint pain is completely gone.
Wow.
I've gone back to dancing.
And that speaks volumes to the ability for our bodies to heal itself. It's incredible at the cellular level for the body's ability to heal, because going through and experiencing those symptoms for so long, did you ever think you would get well? Did you think this was going to be the end-all cure to you being back to normal?
You hope, right? I mean, nothing's an assurance, right? But from what I have read and what I understand, I belong to a lot of different groups on social media, on various social media, where women have registered with these groups because they're having similar issues with implants. And I would say that if you follow those groups and you read what people are posting, the vast majority of women who have their implants removed, they feel an almost immediate, and if not, you got to remember, for some women, they had the implants in for 10 or 15 years. They didn't become terribly unwell overnight. So it takes some time. But if you track women, and I wish there was a global study doing this that was tracking women, 6 months out, 12 months out, 2 years out, I think that what you would see is the majority of them are just drastically better than they were prior. And when people post questions and say, does anybody regret having them removed? You never see anybody
Not
say
one
that
person
there's
says
not a
they
regret.
regret
No.
Well, let's talk about this incredible man, because you speak from the mountaintops about Dr. Shiasset, and you walked in today and I said to you, wow, you look, she physically, aesthetically looks incredible.
Yeah.
And she said, yeah, it's from my stomach. When did they know to pull from the stomach for the breast reconstruction?
It's been around for, I think, using stomach tissue for breast reconstruction has been around for 30, 40 years. But the old school flap, we call it tram, in which you sacrifice 3 packs of your 6-pack for one breast.
Because she is thin too. So
Right.
like I had 2 C-sections. I could probably take care of it. But she's thin.
Right, but now that happened in 1980s, and in 1990s, the surgeon understand more that you don't need a muscle.
Okay.
Okay.
You need the skin and dissect through the muscle. You can get the skin and fat and the artery in the vein and leave the muscle intact.
Oh,
So
wow.
that lead to the concept of perforated flap, which happened in 1990s, and then a lot more doctors get into it. But again, because you need a lot of stamina and a lot of hardworking and meticulous, and you have to pretty much dedicate your practice to do
To
just
these
to this
specific
microvascular
surgeries.
surgery,
That's
because
absolutely
it's
right.
require a lot of skill. The suture that we put is probably smaller than your hair, and we use operative microscope
Wow.
to magnify the blood vessels. So those and right now we've been doing the perforated flap for more than 15, 20 years.
Wow.
Yeah.
So have you seen the technology just from when you started practicing medicine to where we are now? Like you said, the laparoscopic, just the intricacy of how you can just detail everything. Have you seen the technology just skyrocket?
Yes, I think more so for craniofacial surgery when you need a CAT cam, the 3D reconstruction,
Right.
and use that 3D model helping the surgeon to rebuild the face in babies. For the breast, not so much. I think because to make a good-looking breast is nothing can replace the surgeon artistic eye, because you still need to mold and shape the breast. So that's you're not gonna see much progress in terms of the using CAT cam or computer assisted surgery for the breast.
So my understanding, Lisa and Susan, is when you have these outlier cases, Dr. C's your man. You
Yeah.
see people from all over the globe. Can you give us a couple examples? I know there was one baby who was attacked by a raccoon. Is that correct? Where you've had some incidences
Correct.
that
Yes.
You've had some
you were
rebuild
it.
situations.
Yeah, some
yes.
rebuilding.
Yeah.
So that's what I love. I love so much of my job is
Yeah.
to rebuild something not possible. Like so that young lady that you mentioned, she was attacked by a raccoon when she was 5 months old,
Wow.
and then she came to see me at age of 10. She was turned down by many plastic surgeons. It's not the right time yet. But again, when you see the kids who really depressed and look down and you have decision to make whether should we take on a difficult case that may not work, or should you just let her go and then just
Just
not
let
your
her
problem
grow.
anymore. Yeah.
Yes.
So what happened is I think her sort of depression really got me into that we're gonna do something. So
Right away.
right away. So after I rebuild the nose and the ear, you can see she's a totally different person.
Yeah.
We talk about these kids. A child who is born with everything, right? Or has a normal physique. They go through so much stress every single day, whether it's hormones or social media or schools or grades or whatever. So can you imagine these children who aesthetically are not developed or have a raccoon attack?
Correct. Yeah.
You couple that on top of what they're going through, it's got to be devastating. And then you come in and you act immediately and you change their lives. You change the trajectory of their life. You truly do. That's got to be so important to you. And like you said, you could wait because they think more the growth platelet or, allow the body to continue to grow. It's much bigger than that.
Yes.
It really becomes sometimes a life or death situation.
Right. Correct.
It's incredible.
Doctor, when you work on, I have a couple questions. One of them is regarding when you work on children and babies with cleft palate. Is there a time frame? If someone's listening right now and they have this situation, is there a time frame for a best practice time frame for them
To do the surgery.
Usually the first year of life.
The first year of life.
Before the speech developed.
Okay.
So it's very important to restore the palate, because the palate is the fundamental structure for the speech. If they don't hear,
Yeah.
they can't talk.
Right.
So most of cleft kids will have fluid build up in the ear. They will need ear tube placement and cleft palate repair within first year of life, so they can learn how to talk.
Okay.
And you receive children from all over the globe for the cleft
Correct.
palate?
Correct.
Okay.
We bring the kid from Africa,
Mm-hmm.
and you can look in I think in Channel 4 recently, and we help the young man from Nigeria
Wow.
who write a Facebook to me asking for help.
Wow.
He went. I think he wrote email to Israel, Germany, and many countries in Europe. And for some reason, there's no interested to help him. So he sent me an email. We got him in,
Wow.
and not knowing, he actually became a medical student.
Oh.
Not knowing at all. So we get him in. We use our fund. I partner with my ENT neurosurgeon. Basically, we took half of his skull and performed a major reconstruction to remove the tumor. He went back and he sent me an email that he accepted to medical school in Nigeria.
Oh my goodness.
So that, I think his article on Detroit News as well. You can
That's
read.
amazing.
Yeah.
That is incredible.
And I think part of it all comes back to, we so many times we settle, right? We're taught,
Yes.
this is as good as it's going to get. You have to settle for that. But you're changing the status quo, and there's that paradigm shift that you don't have to just stay with
That's so true.
with what your situation is that you face. And I
Correct.
think whether it's a patient for themselves or if it's a parent for their child, to always advocate for
Right.
what's the best possible outcome. And that's what's so fantastic about the work that you're doing. You're giving people a chance.
Oh, thank you. And then Susan's special, though, 'cause she really...
We agree.
Absolutely.
We agree.
Because
Incredible.
sometimes the doctor needs, we learn from the patient.
Yeah.
We know, I don't know everything, but the important thing to be a successful physician is to listen to your patient. And when you listen to the patient, and and you do your best in your ability to help her, or he and she or them.
Yeah.
So that's how I run my practice. Sometimes people think that I'm too nice, too kind, or my job is just keep doing it until the patient happy.
But that's where the game changer is, right? And I see all
Absolutely.
these women that they post things that they've gone to see a doctor. They're all searching for help. Many of them have been going to doctors for 5 or 10 years. They've had hundreds of thousands of dollars in testing done.
Yeah.
Everything's inconclusive. And then they go to see a surgeon, and the surgeon will circle back around and say, it's in your head, you can't do it. They don't want to listen, right?
Right.
Because there's that level of ego that comes with position.
Right.
And that's the beautiful thing is you're one of the most brilliant physicians in the world, but you're willing to listen.
Listen,
listened.
so I see and hear what you have been telling us for some time. They come in like a commodity, and they get them in the door and out the door, and you're
Right,
fine.
right.
Where Dr. C is the difference maker is
sees the
actually
individual.
cares.
Yeah.
He cares
Not
about
that
the
they don't
patients.
care. We don't want to put it out there.
Sure.
But
He's not afraid
you
of something being
sincerely
challenging
care.
for him, though. He's not afraid of it being too difficult, and he's willing. That's where the
the thing.
difference is, right?
I think too, like you said, you're a microneuron surgeon. It is so tedious and it's so time consuming. Where we can watch these shows. You watch Botched or you watch these
Yeah.
reconstructive documentaries. They get in, they're out within an hour to 2 hours. Your surgeries, on average, are
All day.
all
Mine-
day.
Mine was 6.5
All day.
hours.
Yeah. Right.
all
right.
day.
So there's yeah.
therein lines every difference.
The detail, the yes. What
the
you don't-
craftsmanship, all of that, and the heart.
Absolutely.
You.
That's a huge
You.
difference.
What a big. This is.
Oh,
this
it's
is your
huge,
guy.
and here's the thing is again, people settle because they don't necessarily know, right? So
Yeah.
in a lot of cases, for women who have had reconstruction, there's a difference, I think, when it's cosmetic versus reconstruction.
Sure.
When it's reconstruction, you're working after a mastectomy,
Yeah.
and there's many times it doesn't look like a natural breast when you have the implant in, right? And one of the biggest things for me was, because the mastectomy cuts the nerves,
Yeah.
you lose all feeling. I had no feeling around the entire left side of my body, under my arm and around my back. If somebody touched me, I felt pins and needles.
Wow.
Dr. Jayaseth went and reconnected the nerves. When he moved that tissue, I got the feeling back.
So
in my
you
body.
can
incredible.
feel again.
So it's right, and it's, you know, it's, I've said this a million times over since being diagnosed with cancer, right? Breasts are cosmetic, and breasts have a different level of importance to the person. But where the importance lies is every day I have to get dressed or I have to take a shower. And do I want to be reminded of the terrible illness I had, or do I want to be able to get undressed and go, hey, I'm healthy and I'm normal and everything's
Right.
cool? And that's the gift he gave back to
That's
me.
Yes. Yes. And I think for women and men who are going through breast cancer and
Yes.
are experiencing this for the first time, I think it's so important to listen to Dr. Jayaseth or listen to Susan Douglas, who's been through this journey, that because the first thing you think of is, oh gosh, I'm going to lose my breast. I'm going to have a mastectomy. My whole life is going to change. We as women identify, you know, from a feminine standpoint with our breasts. It can be extremely traumatic. And I think, like you said, though, she's different. She's strong. You're a warrior. You knew right away when you had the mastectomy, correct? Did they recommend that right off the gate, or was it something you opted in for?
What
So-
questions did you ask?
Yeah, so part of me going down this rabbit hole of getting silicone implants was part of my coping mechanism. Because when I was first diagnosed, I was told I could have a lumpectomy. They thought that I had 2 tumors. I was one of those individuals whose mammogram masked the tumors. 15% of women, their breast cancer will not show on a mammogram. So the mammogram is not totally foolproof for women who have dense breasts.
But they have a new machine out, right? It's a 3D machine for women who have dense breasts.
Dr. Jayaseth can probably speak to that more than me. For me, it was the MRI. I had an MRI done, and that showed that I had 5 tumors, which meant that the rules of engagement changed, and I could no longer have a lumpectomy. I had to have a mastectomy.
Right.
My way of coping, because I lost a mom to cancer. So I had 3 very young children when I was diagnosed. My youngest was only 5 years old when I was diagnosed. And it wasn't just about me, but it was about that family unit, right?
Sure.
And so I had to figure out how I focused on the positive and how I moved forward to a point of being a survivor and being well. My way of doing that was to not do a lot of research on my own, which now you would laugh at because you know how much I research everything now, right? And I didn't. I was like, I'm gonna make sure I have the best surgeon, and I'm gonna make sure I have the best reconstructive surgeon, because the best surgeon's gonna send me to the best reconstructive surgeon, and I'm not gonna scare myself by reading horrible statistics about anything. And I didn't. So when that surgeon, who only specialized in implants, said, we're going to put silicone implants in, I specifically said, oh, are they using those again? He's like, yeah, they're perfectly safe. And I had them put in, not once, but twice. Only to
Right.
find out after this whole process started and I met Dr. Jayaseth that the second set of implants they placed in me were manufactured in a South American facility
Right.
that was shut down because it was producing contaminated implants that were pulled off the shelves in every country around the world except for the U.S., and they finally volunteered to take them off the shelf in the U.S. But I walked around with contaminated implants in me for 4.5 years. If my car had a faulty part, I would have gotten a recall notice. I didn't get a recall
Right.
on my breast implants.
Right.
What are your thoughts on that?
That's a great point. So many points I like to really underscore what Susan said. Number one, a lot of women who diagnose breast cancer, they're terrified.
Yeah.
So they will rely on the doctors. They need to hold on to someone that they can trust. Now, the breast surgeon, the way done traditionally in this area, is to refer to the body. Now, if they're a plastic surgeon, all they do is putting breast implant, you're not going to hear any other option.
Right.
They may mention that, but you can say, oh, you're not a good candidate. But the person who say that not performing the surgery. So, and of course, Susan just had a bad news with breast cancer. She go to see a plastic surgeon who's going to say, we're going to put your expander and put an implant. She's going to go for it. It's not, and not,
It's a no-brainer.
and nothing wrong with implant. I have to say that. Nothing wrong with implant option.
Sure.
But the option is Susan should know, and decision should be on her hand.
Right.
What option, not the plastic surgeon hand, because that's all they can do. If surgeon should have learned that, okay, I have implant option. This is a side effect. Breast implant illness, lymphoma could happen, capsular contraction, all kinds of those things. And then you have another option, autologous reconstruction with D-flap, longer surgery, bigger scar, and then she make intelligent decision making.
She can
and then she control
make up
her,
her own mind.
she control her own
Destiny.
fate,
Right.
destiny.
Right.
And that's not happen in many situations.
Right.
Part of it because not many microsurgeons out there. It's not just a few of us in Metro Detroit, and because it's such a time consuming. And another thing is incentive. You have to say that because the medical reimbursement for implant itself for 2 states is not much different than you spend 8 hours of your life doing reconstruction for a person you don't know. So people are probably gonna just put implant, call for the day.
Right.
Right.
So they're not given their
it's
options.
a road
right. And you have
less travel.
You have
Yeah.
to remember, right? Every person has a different education base and a different socioeconomic base and a different ability to be able to understand all of this. And it wasn't until I started diving into the information and the statistics. If you go to the FDA website, it talks about all the symptoms of breast implant illness.
Okay.
In type this small, and it's buried way at the bottom if you read 47 pages of information.
it's not up
And
front.
Well, you
Yeah.
tell me how many people who are going through a cancer diagnosis are going to actually do that.
They're not.
Right? They're not.
They're not at a certain point.
They
yeah.
are in survival mode. They are
Exactly.
terrified. They just
Bullet
are
points
worried
are
about
best.
tomorrow.
Right.
Exactly.
And I think there's two important factors in a physician, right? All doctors graduate from medical school. That's how they get the letters behind their name. But some graduate at the top and some graduate at the bottom of their class.
yeah.
We think Dr.
right?
C's at the top.
He's definitely
He's
at
at
the
the
top.
Praise
Right.
the Lord. I
Right.
have to say,
sure.
I will have to say, I think the message here for Kaiba Health and Life, and what a beautiful platform that we get to showcase such amazing leaders, such as Susan, leading the way,
Yeah.
telling your narrative, telling your story. As awful as it is, guess what? It's empowering, and if your story changes 100 lives, even one
If it
life,
changes one life.
thank you. It's well worth it. Then we have this man to my right who is taking on cases that no one is touching, and he is changing and saving lives. Because while having that physical, anomaly, they have anxiety and they have depression and they have psychological issues that come hand in hand, especially at a young age before their cognitives develop as children, just trying to live in a very aesthetic society. So what you are doing is truly magical and God's work, and thank you. And I'm so glad you two were able to connect.
Yes.
And I'm so glad that you are here with us, because it's only the beginning. We want to have you on. We want you to continue to tell this narrative to our listeners, to our viewers, because if you're just being diagnosed with breast cancer, or if your child is born with a cleft palate or an anomaly, we want to make sure you have the knowledge, the education, the resources,
The option.
the choices.
That's right. And know what questions to ask. What are my options?
Listen, if this were easy, every single doctor would do it. It is
Yeah,
not easy.
it's not.
He is a specialist. He's an outlier physician.
Absolutely.
And I know from a personal standpoint, having a child whose surgery was 20 plus hours at 24 hours old, it's very meticulous. So, my goodness, Dr. Concrete Shayasset, I didn't know I could speak such beautiful language. Royal Oak, Beaumont. How can people get a hold of you?
Google me.
They can
They can
Google him.
Google.
We will have all his information
Yes.
on social media accompanied with this podcast. We'll get all his information out. Please contact him if you're going through this, or you have a family member or a
absolutely.
friend. Contact his office. He's absolutely amazing. Same with Susan Douglas. You are a plethora of knowledge, and you are so willing to reach out and tell this story and help and provide, most importantly, provide resources.
Yes.
I've now had women from across the country contact me, and I'm willing to share what I know, because if what I am sharing makes a difference for one other person, then I didn't go through all this for nothing.
Right.
And that's really what my mission is.
And, Lisa Metropolis, you two really connected in the same thing in telling your mom's story, right?
Yeah.
Because your mom had lupus
Absolutely. You become an advocate. And I think we had talked about that before. And that's one of my, I was talking about biggest takeaways. One of my biggest takeaways with you, Susan, is your advocacy. This has turned you into a women's advocate for the best things.
For yourself.
Thank you.
For yourself.
Right.
Thank you.
Know your body. Know, like the
If
good
something
doctor said,
seems wrong, you need to do something about it.
it's wrong.
It's wrong.
It
Trust
is wrong.
Trust your own intuition.
Yeah.
Group hug. Thank
Group
you.
hug.
Amazing panel. Thank you beyond
Thank you.
words. Lisa Metropolis.
Thank you.
Thank you.
What a great day.
Susan Douglas.
Thank you, my friend.
Dr. Concrete Chiasset, Royal Oak Beaumont. Please check him out. This has been an amazing show. Thank you to our viewers and our listeners. This has been Kaiba Health and Life.